morning.
Good morning.
See, that's what I get for playing. That's what I get. Okay, I hear something. I don't know what it is. I don't
It
know.
could be
Okay.
my fan.
Is that what it is?
You got some good ears because it's very.
Oh my. I was like, I'm hearing something. I don't know what I'm hearing, but okay. Good morning. First
Good
of all,
morning.
I told you my plight. Let me just
Mm.
share 2 seconds. I just want to go home. That's what I told the gate agent last night. I really just want to go home. What was supposed to been a 1 day go to Chicago. We went to Chicago on Wednesday for the all day um, component association leadership meeting. I got on a plane on Thursday thinking I was just going to come home on Thursday night. Well, no, I still haven't made it home. It is now Saturday. Prayerfully, I will get there today. I've been
Hopefully.
to Chicago, Detroit, Atlanta. Yeah, now I'm in Atlanta, and then I'll hopefully fly home today. It's I was like, okay, yeah, it's been a thing.
Wow.
Everybody is like, "Are you serious?" Yes, it's been a whole thing. But we're here. We're here.
There you
It
go.
could be worse. It could be
That's right.
worse. So, uh, and I'll share this, and then we'll get started. There was a lady at the agent talk or at the gate talking to the agent, and she was talking about how she missed her flight because they changed the gate and they didn't know, and I guess she was trying to get a voucher or something, and the lady was like, "Well, we're not doing that, but you can go to the international floor. It's normally not a lot of people there, and I can give you a blanket." I was like, "Oh."
Wow.
I said, and she gave her a blanket, and the lady went on about her way. I said, "Oh." I said, "I don't
Wow.
want her. I don't want her. Lord, please don't let that lady
Mhm.
be." And I think 3 people out, she left. She was, and she had probably had her feel, so her shift was over. So I was like, "Oh, I don't want her." She feeling it at the end of the night. All right, all right. Well, we're here. We're here. Yay. Yay. Well, welcome to our Saturday morning tea, where we discuss health information, news, education, certification tips, and entrepreneurship. The revenue cycle at large, uh, the weather, travel mishaps, the fight in this world in healthcare, all of the
Mhm.
things we discuss it all. As you come in, don't forget to hit the thumbs up or like button. I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. And let me ask you, do you know? Is my banner still scrolling? Do you know what it takes to be a certified marketable medical coder? Well, before I introduce my co host, let me share with you information on a free, yes, free 99 email course on the 5 steps to become a certified marketable medical coder.
Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder.
All right, all right. Oh, speaking of music and me dancing, I got a whole DJ app now. It's going down. I
Oh,
just
that's nice.
where I can create some it's about to go down. Look, it's about to go all the way down. Okay. um well we don't have our clubhouse friends today because I'm not at home. But if you would like more information and you're joining us via YouTube, Facebook, and LinkedIn, you can check out the video description for the link. I promise you it's down there. I've linked a whole bunch of stuff, but I promise you that link is in there. Joining me today is my illustrious co host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia, Pennsylvania. I've been a nurse for over 30 years now. And during the pandemic in 2020, I created a company called the Coding Nurse LLC, where I help nurses and other healthcare providers or healthcare employees with clinical backgrounds transition into the wonderful world of HIM. And I transitioned into HIM in 2014.
Well, look at you. And how's that going?
It's going pretty well. And
Yes,
my
yes.
light just died, so I was like, all time. But I have a replacement bulb, so I'll get to it.
Okay. Yeah, I'm like, I don't have lights. I'm facing the window. I've always turned nothing behind you, face the window. So I'm facing the window. Here we go. Good morning, Vicky. Good morning. Good morning. Good morning to the healthcare business consultant. Good morning. Welcome. Thank you for
Good morning,
joining.
Molly.
Good morning, Molly. Okay. Yeah. So if you are, well, before we jump in, let me remind you that this is a conversation. This is a conversation about various topics that we have found throughout the course of the week, sometimes the month. Sometimes we put stuff on the back burner and bring it up later. But this is a conversation. So we want to get your comments and we want you to join in on the conversation. So don't be shy. Your opinion matters here and is welcome.
Definitely.
For my Facebook, YouTube, and LinkedIn friends, you all know what to do. We talk in the chat. So keep talking and we'll keep listening and keep discussing. If you have a question, please type a Q first so that we know it is a question and we don't miss it. But feel free to engage us in conversation. And we're at the church announcements. And if you have a church announcement, you can place your church announcement in the chat as well. We will definitely add you to it. So let me get my church announcement things queued up here.
All right.
I need all of that in my spirit today as I head to another airport and spend 5 hours. Yes. Okay. Church announcements. I'll talk more next week about the leadership, the Component Association Leadership Symposium that I attended in Chicago for AHIMA. But I will say this. I think I can say this. I'm hot off the presses. They're leaving their building. They're moving.
Really?
They're moving from 30,000 square feet to 10,000 square feet as a cost saving to their members. That was a hot off the press. I was like, oh my God, what? And so if you never got an opportunity to visit the building, well, hopefully the new space will be great, but there was so much history in that building. And that was one of the things I talked about because we weren't in Chicago proper. We were actually at the airport at our meeting. And normally we're at either in the offices or located very close and would go and take a tour for people who had never been there. And when I went, it was several years ago, I got to take the tour and I, took pictures of everything. But it was like the history of everything AHIMA on the walls and in the hallways. And it was a sight to see. When I tell you, seeing that 100-year plus history on the walls was amazing. And so I hope they do, I'm sure they will continue to archive all of those things and find a space for that for people to come and visit, and especially the members who, if you've never had an opportunity to see it. But yeah, somebody asked, we were talking finances, and finances are not as they should be, as with most organizations during this time. And as a result of, well, I think some things had dipped before COVID, but then, COVID hit and things dipped even further. And somebody asked, I want to say it was Rose Dunn. I met her. I had a conversation with her, and I thanked her for all of her articles that I talk about on a regular basis. But she was like, "Well, I appreciate you. Thanks for sharing them." um, but she asked the question about had there been any consideration to moving from the home office, and they said yes, they had already signed the agreement and the contract, so they are moving. I was like, oh, and so it was applause, but that's fiduciary care. That is making sure that you don't spend money that is unnecessary. And I think they have a lot of people that are working from home or working offsite, so they don't necessarily need that huge prime real estate space anymore. And they spent a pretty penny there. I want to say he said a million something. They spent a pretty penny there. So that goes back into the coffers. And then the other thing, they are starting the micro credentials. I think I talked about that from the advocacy meeting last year. And so the micro credentials are rolling out. I did not go to that particular session, so I'm not 100% certain what they are. I know they mentioned release of information at the advocacy meeting. I don't know what the other ones are, but I think they are rolling out next month. So be on the lookout. Check your emails if you are a HEMA member on what's happening with the micro credentials. The last church announcement that I have is hot off the press, y'all. When I say hot off the press, I mean, when I rolled over this morning, it was in my email box, hot off the press. And I'm like, ooh, my friends over at the AMA, they not playing with y'all. They coming for everybody. When I say everybody, I mean everybody. They are back. And this time the focus is on scope creep again. And they want to, the question was asked, is that resident or attending a doctor? Not always. It's all about the physician over here. And they want to make sure that it's crystal clear who your practitioner is. They have raised some concerns about the confusing terminology with professional organizations representing certified professional midwives, clinical nurse specialists, nurse anesthetists, nurse practitioners, and physician assistants, which I thought they went to physician associates, but that's neither here nor there. They put that as physician assistants. And so much so that a new video has merged and surfaced. And let me see, I think I can show you the video. I said, well, they got a lot of money over there. That's all I want to be like that when I grow up. When you come, you come. Don't play around. Don't do any of those things. Come forward. Okay, let me share my screen so you could see this hot off the press video. Okay. Okay.
The challenge of scope creep is one that has been going on for years.
Unfortunately, it appears that even with our doctor shortage and because of it, that individuals are taking the notion that we can get by with fewer doctors with using physicians, assistants, nurse practitioners instead of doctors, which I think is a very flawed concept.
Removing the physician from the medical care team of a patient lowers the quality care the patient receives. But we do believe in the team, and we do believe in our teammates. But the physician heads the team.
We need to embrace physician assistants and nurse practitioners. And we need to say, how can we help you better? How can we do a better job together?
The campaigns that they assisted us with were phenomenal. We've had statewide billboard campaigns, statewide commercials that were very impactful on the public's perception as physicians as the leader of the healthcare team, and very impactful on a state level.
They've done direct testimony. They've been on the TV, and their impact makes a difference. And using those AMA resources really matters.
With their truth in advertising campaign, I think it's incredibly important. Our patients deserve to know who is treating them, and they also deserve to know the level of training of that clinician.
My being a member just gives one voice, one opinion, but combine that with thousands of other physicians all over the country.
You really speak with the voice of medicine, and that's really what the AMA does best.
They showed up ready to work, and they really were at our backs, and we have a strong ally with us.
The AMA's strong work to help avoid scope creep has been important to me and to my entire specialty, and actually to physicians across the nation.
Fighting scope creep means maintaining quality patient care that is physician-led.
Scope of practice means health equity, making sure that everyone has access to care.
Fighting scope creep means better care for my patients.
Now, the one takeaway that I got from this whole thing was this is how you advocate for your members. This is what you do for your membership. This is how you show where those advocacy. I mean, yes, we still need legislative advocacy. I'm not going to take away from that. But from the professional side, this is how you advocate for your profession. That was my strong takeaway. Mr. Jesse, you have any comments?
And also, they what they're doing is something that is also a very good tactic. And you know, a lot of policy is won in the court of public opinion. So whoever did the video was great. You definitely
Did they not hit it? They hit it out the park. They hit it out the park. Good morning, Crafty Coder. Welcome, welcome. They hit it out the park. Yes, she said it's about protecting their power and money. Yes. And so in conjunction with that video and the messaging around that, they came out with their truth in advertising campaign. And it says it's to ensure patients know which, and they have in quotes, doctor is providing their care. Truth in advertising legislation requires all healthcare professionals to clearly and accurately identify themselves in all writings, advertisements, and other communications, requires all healthcare professionals to wear during patient encounters a name tag that clearly identifies the type of license they hold, and prohibits advertisements or websites advertising healthcare services from including deceptive or misleading information. And so they have a whole, well, they showed the book. So they have a whole book and all of the things. And so the fight is back on.
Me personally, I don't necessarily have a problem with that because, first of all, like nobody's running around pretending to be something that they're not.
Exactly.
And my thing is, let's not stop there. Since you want to play the truth in advertising game, let's talk about, you should also have to disclose how many lawsuits you have pending.
See, sir, no, I'm not home. So I don't have tea. You know I'm not home and I don't have strong tea here.
If you want to tell it, look. If you want to tell it all. So you want to protect the public.
Exactly. Wow. I hear a shot fire. Ooh, ah.
Mhm.
If you're gonna tell it all. Run tell
That's right.
that. Run
That's
tell
right.
that.
How about shooting
Interesting.
advertising?
I love that. But you're
Mhm.
absolutely right. I mean, keep it 100. Keep it a buck.
That's
Keep it
right.
a buck. As they say in these streets, keep it a buck. So yeah, that
Mhm.
was my church announcement. More to come. You know, the AMA, they're not stopping till the wheels fall off, I guess. So more to come on all of that.
When I tell
But
you
yeah,
they are good,
again, if you needed a master class on how to advocate for your membership, they've just provided. It's all
and
right there.
also a master class in what you do with your PPP money.
Mm.
Because this is coming from somewhere.
Oh my God. Oh my God. I don't have the strong tea here. Sir, I'm not ready with the strong tea. I love it though. Now that is a master that is a master class. Wait, she said keep it a buck or get buck. Okay. Oh my goodness. All right. So those were our church announcements. Did anybody have, I know, isn't he always? Mr. Jesse is going in. Um, if anybody has any church announcements, again, feel free to put them in the chat. Mr. Jesse, did you have any church announcements that you wanted to for the good
Nothing
of
that
a
would nothing that would even come close to that one. That's
I'm sorry. Like I said, it was hot off the press when I rolled over this morning. It was in my, I was like, y'all working on a Saturday morning? Y'all dropping all of this on a Saturday morning? All right
they
now.
not, they not playing.
They're not playing. Be like, we want to get y'all while y'all ready. So all of the members are
Mhm,
probably ready for this stuff to get ready to start sending out to the folks. And so I'm sure there's a
mhm.
massive campaign that's going on as we speak. And here, look at us, we're part of it. But again,
Sorry.
again, I think this was an opportunity to share some information. It was a learning. The takeaway for me, it was definitely a learning. Okay.
Yeah.
Well, if you are just joining us today we are going to discuss um, risk adjustment accuracy, healthcare, the healthcare crisis, even though we just discussed a little bit of that and some new codes. Mr. Jesse, did you want to start with the with any of these?
Well, actually, I was just really interested because when I saw the headline for the risk adjustment, um, disparity with the data, I was just thinking, oh my God, we black folks, we just never, you know, and come to find out, it wasn't even about us.
It wasn't about us.
I was,
Right. Don't you like me? I be bracing myself like, is it
yes.
is it what is it? Yeah. You're absolutely correct. It wasn't even about us. So there was an article by Kelsey Waddle um, discussing the HCC model used for Medicare Advantage risk adjustment. And it discusses how um, there may be some inaccuracies related by race. And primarily the it's consistently underestimating American Indian and Alaska Native beneficiaries' costs. And so I guess they looked into some data. Um, they had a study that looked at HCPCS codes in 2018 that could be risk adjusted and the claim spending for them. And they partnered with your people over there, Inovalon, to access the CMS data and receive funding from Arnold Ventures to do this. And so the data, they also compared the fee-for-service beneficiary spending to the projections from the CMS HCC community model and determined that there were some underestimation as it related to some of the projections. So the projections were overestimated, and the lower ratio showed how much the projections were underestimated. And so that was interesting. Like you said, for non-Hispanic white beneficiaries and Black beneficiaries, the model's prediction closely aligned with the beneficiaries' actual cost. Um, but for other minority populations, um, the results were less accurate, and so pretty much they missed the mark. They're not paying attention to us as everybody as a whole, and that's not good. There's more than just the two races and ethnicities. We come in all shades, and we need to make sure that we are providing the information and data across the board for everybody. So yeah.
But what I found interesting, and I'm like, maybe I might have to do a little deeper dive. But I just wonder because because the group that was most underestimated are the Native American,
Mm.
Native Americans, and I'm like,
Mhm.
I wonder because they have their own their care is under the Indian Health Service.
Mhm.
So I wonder how I don't even know how that program runs. I've never had any experience with it. I've never done any, to my knowledge, any reviews for any kind of Indian Health Service provider. So I just
Mhm.
wonder how the program is administered, and if that is if that is a causal relationship with this underrepresentation.
Yeah. And are they also bound in providing the information or providing that data so that they have it? Or what does that look like? Yeah, you're
Right.
absolutely right. You're absolutely right. Get to
That's
the
interesting.
root. Get to the root.
Yeah. The Crafty Coder has a I think that's a church announcement.
It is a church announcement because she brought it to our attention, but first, not really a church announcement, but although Cigna said never mind on 25 modifier fiasco, Anthem made no announcement. Oh, and they are denying all with the 25 modifier. Really? Did they also make information available that this is the route that they were going to go as well? I didn't see anything on Anthem. That's interesting. But I guess if you were Anthem provider, you knew, huh?
Mhm.
Interesting. I'll be pulling up Anthem this week to see what that looks like. Wow. So while Cigna said they wasn't ready, Anthem was like, "We got you. We ready. We in the
Mhm.
pocket." Wow. Yeah, that
That's
is a
our
church.
field representative.
Huh?
That's our field representative.
Yes, the
Crafty
field
Coder.
representative in the
Yeah.
our person in these streets, streets.
Yeah.
I love it. Thank you. Appreciate it. So that's interesting. That's interesting. Wow. So just when folks thought they may have could take a breather, Anthem is coming for you. So no, get your stuff together. Get your stuff together.
Mhm.
I'll be curious. Like I said, I'll look and see what information Anthem may have put out there. True, 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 true. She said no need for an announcement. Uh-oh. No need for an announcement. Just do the ish. Denied. Oh, she said, and Edna also. Wow.
Ooh.
Yes. Yes. Okay. Yeah, well, I guess their partner in crime wasn't ready. It's like, well, you know what? We got you. While y'all get y'all stuff together, we'll show you how this is supposed to be done. And they're out
Mhm.
here doing it. So yeah, everybody, make sure. Did they have the same requirement where they want them to submit documentation prior to, or they just deny? Period. Off top. And then wanting it on the back end. Because I think that was the big piece with Cigna. She said, right. I don't know what is. All her injections are denied. Okay. Well, we'll do some additional investigatory reporting on this to find out the what, the when, the The where and the how. Oh, pre and post payments. Okay. Okay. All right. And recoup. Ooh. Oh, they not playing with y'all. They feel like money is on the table and they going to get it. Get y'all stuff together. We tried to warn you. We tried to warn you. Stay in the know. All right. So let's talk about, well, since we've already talked a little bit about it's in the guidelines. Okay, so we talked about the AMA. There was another AMA sighting, if you will. This is from the CBS Evening News by Nora O'Donnell and Alicia Hasty. Hope I'm saying her name right. New American Medical Association president says we have a health care system in crisis. Did they just know that? I was was that new? The Dr. Jesse Ehrenfeld is an anesthesiologist, a Navy veteran, and father, and he made history when he was inaugurated as the new president of the American Medical Association, becoming the first openly gay leader of the nation's largest group of physicians and medical students. And so he is at the helm of all of the things that are going on at the AMA, or he's taking ownership, or he's taking over as the new president. He talks about the twindemic, a pandemic of disease plus a pandemic of misinformation and bad information. He talks about how physicians are facing burnout, the soaring medical costs, and an influx of legislation that is targeting the LGBTQ community. I'm sorry, he didn't talk about that. He just said that this is a difficult time the writer said that this is a difficult time that Dr. Ehrenfeld is taking over because of those factors. But he did say we have a healthcare system in crisis, and he hears that from his physician colleagues. And we see the results of that and the things that they're doing over at the AMA. He said today there's so many backseat drivers telling us what to do. You know, we've got regulators that are discarding science and telling physicians how to practice medicine, putting barriers in care. He says we have at least 6 states now. If I practice evidence-based care, I can go to jail. He said it's frightening when a patient shows up in my office, if I do the right thing from an ethical perspective, to know that that care is no longer legal, criminalized, and could wind me in prison. He says that criminalization has occurred in areas including gender-affirming care and abortion services. He says that healthcare has been a target as of late in a way that has been deeply damaging, not just to the health of patients who seek specific services, but to every American. Yeah, he tells it all. He says he hopes to improve health equity for all underserved groups and be a role model for any young doctors, as well as for his own sons. He hoped that they learn that they shouldn't let anything get in their way of following their dreams. And for anybody who's different out there, I hope that they see themselves, my children, the example that I've set, that they shouldn't let anybody tell them that they can't just because of who they are. All right, I have a dream speech. Oh, I'm sorry. All right. You have any comments on this particular article?
You know I do.
I know you do. Let me sit back.
What I don't understand is, well, what I find so interesting about this organization is they refuse. You know what? They need to change their name from the AMA to the ANA, the American Narcissist Association, because these people take no accountability for anything. And if you are talking about, let's just really just revisit where all um, this dissension came in. There were doctors who were not using science-based um, information to put out there. It's doctors that are behind not wanting to provide gender affirming care, and these people are these organizations are using medical professionals to back them. So
Mhm.
if you wanted to take care of all that, why don't you as an organization say, if you are a licensed physician and you put out unscientific information and you stand on it, you will not be represented, and we as an organization will go against your licensure in whatever state you are. They did it in nursing during the pandemic. If you were a nurse and you publicly said something that was counter to medical information, you could lose your nursing license. How come medical doctors can't lose theirs when if it's causing such dissension and it is causing a twindemic? I'm just so over it. Like, no.
And Lord knows we need regulation and legislation, because clearly folks run them up when there's not.
Exactly.
But we all know that it all comes down to one thing, and can we just talk about the documentation of all your scientific evidence, of care? Again, the documentation. Some of these things that can be avoided. Some of this administrative burden can be avoided if the care was documented appropriately and accurately the first time. All that other talk, the tapping on the shoulder, the queries, the hey, could you do this, the hey, we need now to see your charts, the hey, all of that could be avoided if you if the one of the jobs that you had is documenting the care that you provide to that patient and why. It could all be so simple. I feel like he wants some music. Yeah.
I agree, but it's just
But that's not the focus of the AMA slash Mr. Jesse's ANA. It's not the focus. And maybe behind the scenes, maybe that's the okay, y'all. This is what we're gonna put to the people, but we got to take care of our house, and hopefully somebody is maybe taking some strides to clean up their house, and maybe they're having some conversations about cleaning. I would hope that somebody is having some conversations about cleaning up the house. I heard a quote the other day. Leaders think about and talk about solutions, and followers think about and talk about problems. Hopefully, there's some leaderships that are thinking and talking about solutions to not necessarily what's external to their organization, but what's internal to their organization. Yeah. Look at your face, sir. It's like you got the whatever. I am over it face.
I mean, we just discussed two very different I guess, well, two current two issues from the same organization. And none of it mentions accountability. It doesn't even scratch the surface. They don't take any ownership in any of this. This is not their fault. This is just, they're just, this is all part of their compassion and sacrifice.
Now that's your quote.
That's what that lives rent free.
Yes. So, Crafty Coder, the quote was, leaders think about and talk about, what did I say? Leaders think about and talk about solutions, and followers think about and talk about problems. Yeah, that was the quote I heard. I said, oh, okay. That resonated in my little spirit, in my little soul.
Mhm.
Okay. For our coders out here, y'all know it's that time of the year And we talked a little bit last week about the new ICD-10 PCS codes and guidelines. Let's see, we got some data. Lori Johnson from the ICD-10 Monitor put out kind of a chart that lists, and maybe I'll show this. That'll make this easier. I'll show this. She put out a chart that outlines the information, and I'll have two of them. I'll show you both what she provided for PCS and then what she provided for the CM. Okay. So she has what happened. She actually did a side-by-side analysis of each of the sections and what happened in the April update, as well as what is going to happen for the 24 update that happens in October. So there's a total of just a few codes. There's a 73 code difference in these areas. Most, let's see.
I think most of the new technology, I think is
the new technology is the one. It's the largest increase. They have 40 codes. And so this is just a distribution of the changes in the codes. And yeah, new technology got it all. She said the body part key has also been expanded to include appendiceal orifice for appendix, middle meningeal artery in the intracranial portion for intracranial artery, and chin for subcutaneous tissue and fascia of the face. The body part key is an appendix for ICD-10 PCS. If you did not know or you don't use that. There were several devices that have been added to the device key. There were several substances that have been added to the substance key. Again, the new technology got all of the new things. It's brand spanking new with some the majority of the additions. She indicates that there will be many changes in the new technology add-on payment for 2024. There are 6 new tables in ICD-10 PCS in the new technology section. X05 for nervous system destruction, X2H, new technology section cardiovascular system insertion, X2U, new technology section cardiovascular system supplement, XNR, new technology section bones replacement, XV5, male reproductive system destruction, and XX2, physiological systems monitoring. The updates, we mentioned this last week, the guidelines have been updated in response to public comment and internal review. Guideline B 5.2b, percutaneous endoscopic approach with hand assistance or extension of excision, was amended to include hand assistance and temporary exteriorization of a body structure was added. Another guideline that had been updated, B6.1a, which is a general guideline, so that the example of the quote, the device size is inadequate or an event documented as a complication occurs, end quote, has been removed. So that was some of the information. And if you listen to their weekly podcast, they will dive more into the details on the PCS codes and guidelines and the new technology add-on payments on their August 16th podcast.
Well, actually, with that, go ahead.
Go ahead. No, go. I was just stopped sharing.
With the guideline you just mentioned, the B6, where we talked about the inadequate device size.
Mhm.
I had that. I had a case like that about a month ago. A person had a, a a biliary stent put in, and they
Mhm.
developed a complication because the stent was too big, so they had to go in and take it out and put a smaller one in.
Hmm. Well, look at you. We got the straight from the bedside, straight from the clinical component, straight from the profession. Um, Practical application. That's what I'm thinking. Look at the practical application of the information that we're providing. I love it. I love it. Okay. Let's see. She said I saw that this week. I emailed the coders I work with. Yes, yes, yes. And that's why we're here to provide the information. So folks kind of, I like to be proactive versus reactive. So getting you prepared, getting you ready for the things that are coming down the pipe. So with that being said, let's take a look at the um, CM codes, diagnosis codes that are coming to us live in these streets. Okay, so Lori also put together an article for the Monitor. Um, this is they released this on Friday, June 16th. The release included 395 additions, 25 deletions, and 13 revisions. The deletions are due to the expansion of the diagnosis codes. The total code count for 2024 is at 74,044 codes. Again, these are all effective with the October 1st, 2023 visits or discharges. Um, she did it a little different this time. So she listed all of the chapters and show what was either added, deleted, or changed. Um, I believe external causes were the winners here with 123 new codes. She said the expansion in this chapter pertains to foreign bodies, including button batteries, other plastic objects, glass items, magnetic metal objects, non magnetic things, rubber bands, food, non organic items, and sharp objects entering into or through a natural orifice. The musculoskeletal system chapter comes in second with 36 additions. There's some age-related and other osteoporosis with sites of left, right, and unspecified pelvis are the reasons for these changes. Next, you have eye and diseases of the eye and adnexa, which is chapter 7. 34 additions and one deletion. One new code includes non-proliferative and proliferative sickle cell retinopathy, specific eye muscle entrapment, and foreign body sensation. The changes also include laterality. And then the fourth most changes are found in chapter 21, which are the factors influencing health status and contact with health services, with 30 additions and 6 deletions. Um, the new codes include observation of newborn for suspected condition ruled out, carrier of Acinetobacter baumannii bacteria, encounter for prophylactic measures, family history of specific colon polyps, and caregivers non-compliance type. Oh my God, that might be me. Okay. The social determinants of health have also been enhanced with new codes for child custody and parental adult-child conflict. Um, the new code topics can be found in the materials for the coordination and maintenance committee meetings that we talked about that happened in March. Don't forget, and September of 2022, we will have more information on the upcoming ones. Remember, they do it kind of a year in advance so that they can take you. Recently were for next October and possibly for next April. Um, the guidelines changes were not released with the new codes. That document is a coming attraction, so stay tuned. We will definitely bring that information up for you. And so they will go into more detail on their upcoming webcast on October 15th. All right. I think we got it all in. Got it all in. Any comments? Oh, Ortho got a lot. Let's see. She said Ortho got a lot. Chapter 13 and 19. Yes. All right. So there you have it. You got information on the new codes for both PCS and their guidelines, and then the new codes for the diagnosis side of the house, as well as the AMA masterclass and the ANA rebranding.
Yes.
Oh, all right. Well, Mr. Jesse, you have any other things for the good of the order?
No.
No.
This was
Okay.
it was action packed, but we covered a lot of territory.
We did. We did. I was nervous because as I kept adding the links, I said, wait a minute, we're going to run out of time. We're going to run out of time. Yeah, but this was great. I love it. Yeah, even, while I'm sitting in all these airports, I had some time to read. I said, oh, okay, well, let's pull out the handy dandy. I don't try. I travel with my laptop everywhere I go, so I'm always. You stay ready. You ain't got to get ready. So I'm always ready. And so when I said, I'm not gonna even be home to do. I said, oh, girl, you got your laptop, and I got my little mini mic. Oh, you can't see it because of my little mini mic.
Okay.
So I'm ready. Next, I need to just go on and bite the bullet and buy me a mini mixer. If I find me a small mixer, then I can make sure Clubhouse goes with me as I travel as well. That'll be the next thing to do.
Oh, thank you, Crafty Coder.
Yes, yes. Mr. Jesse is becoming the superstar in these streets, providing information. And you need to see if she wants to come over here and talk about some of the wonderful work she does with the billers on the revenue cycle.
I sure. Well, that's a good idea. I'll reach out to
Yeah,
her.
yeah, Miss you she's more than welcome. I've sat in a couple of her sessions, and they're doing the thing over there at Ask the Biller. So if you are interested in learning more or becoming certified as a biller, she is a wonderful resource.
Definitely.
She's a wonderful resource and will provide information. And if you are actually if you're looking for that certification, but if you're also looking to broaden your entrepreneurial skills as a biller, she has a wealth of knowledge and experience, and can assist you in that endeavor as well. So check out. So yeah, see if she wants to come on and let us introduce her to our folks, the world, everybody. That will be fun. That will be fun. Well, thank you, Vicky. Yes, yes. You are welcome, because she's so silly. The tea has been spilled. At least I think so. I'll ask again. Was the tea spilled today? Was the tea spilled today? So thank you all again for joining the Saturday morning tea. If this information was valuable for you, again, please help us by sharing this message with others, sharing the video, subscribing to my channel. I'm still trying to get that 10,000 subscribers for the year. Make sure as you leave, and as you leave out, don't forget to hit the thumbs up, like button, and subscribe button. You can also check out the Coding Nurse channel on YouTube. Mr. Jesse is over there doing his thing, providing information. We also, I think, are on other platforms. I'm playing around a little bit. I played around on TikTok this week. playing around on Instagram, trying to do some things. So let's see what happens. Let's see what's happening. Let me see. Whoa. Someone said, I'm starting my career as a medical coder, but I have no idea what's a clinical analyst's role. Oh, we had wonderful conversation about that just recently. I know their data analysts. I know AHIMA has the data analyst pathway. If you go out to AHIMA, their website, I can't think of it off the top of my head exactly where, but if you go out to AHIMA website or put in AHIMA job pathways or something, there's a whole pathway that you can click on and it'll further outline what those job titles consist of, what the skills are necessary for them, and how you can get to that level. So check out the AHIMA website, Mr. D. And thank you for your comment and welcome.
Definitely.
Welcome. All right. Let's see. So this has been a great session. We'll be having our meeting after the meeting shortly. and we'll get our things going so that we can include and invite those of you to the meeting after the meeting. Thank you all again for joining. And remember, thank you. She says, another great episode. Y'all have a good weekend. Yes. This has been a great session. Thank you for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care. Make it a great weekend. Bye.
Bye, everybody.